Do you feel a nagging pain on your groin area with difficulty engaging your core muscles, your pelvic floor, as well as if you have SI joint dysfunction? It could be from giving birth. If you have perimenopause and menopausal, you're getting weak on your gluteal muscles. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be demonstrating a lovely Pilates yoga physical therapy to strengthen and stabilizes your back, your core, your pelvis, and your hip joint. You will need a soft foam roller and gentle mobility work. We want to make sure you engage with proper breath work. So if you have a groin pain, there's a lot of factors. It could be a labral tear. Number two, it could be SI joint dysfunction and pubic symphysis pain, which is the joints that holds our pelvis together. The joints in our pelvis are movable, a little bit gentle movable, just like our teeth. So when we have hormonal disruption, it could be pregnancy, postpartum, if you're breastfeeding and your hormones are still up and down with all of these hormones for breastfeeding. So that's why when you're breastfeeding, you're a little bit lax. Your ligaments and soft tissues, your SI joints are very rich in blood supply. And it also a lot of nerves that supplies all the way down to our legs. So sometimes you have a nagging pain down your leg. And if you are also perimenopausal, menopausal, your hormones are slowly going down, our estrogen level, our progesterone, and even our testosterone. So for women, I really suggest for you to see your OBGYN, your gynecologist, have some lab work done, check your hormones, check your TSH, check your follicular stimulating hormone, the FSH. These hormones help to navigate, to learn if you're secreting a lot of these hormones because you're really low supply in our estrogen. So why does the estrogen go down? Where do we get our estrogen? So for women, there's two types of estrogen. Estradiol is a different types of hormone. It's like an estrogen, but it doesn't come from our ovaries. Once we turn 30 years old, we only have 25% eggs left. And then when we turn 40, 1% eggs. So that's average. So if we have millions of eggs once we were born and you have your puberty stage, and that's why childbearing years from 20 years old and above, and when you turn 30, that's why women started having this hormone problem. They started IVF treatment because of what we're putting in our body. It could be stress, a lot of free radicals, hormone disruptions like plastics, microplastics in our system. And that's why we need to keep our body strong and healthy. And also for young ladies who started taking hormones at the young age because their doctor gave it to them because of their problem with their menstruation. Unfortunately, when you started birth control at a very young age, yeah, you have still a lot of eggs left, but they're not viable for childbearing. There's still a lot of eggs, but they don't become more efficient. They become less effective for eggs that you're releasing every month. If you decided to have pregnancy, it becomes less viable for having a successful fertilization of the eggs. So that's why once we turn 40, we only have 1% eggs left. And once we turn 50, that's our perimenopause starts sometimes from late 30s all the way to 45 and from 40 to 50. The average age for menopause is 50. So once we lack of eggs and you don't have your menstruation, you'll find out when is your last period. If you're having no more periods for 9 months, then that's guaranteed you're menopause already. And if you're menopause already, where do we get our estrogen? We get it from estradiols. It's not from our eggs because we don't have eggs anymore. So our body will keep stimulating the FSH knowing there's no more eggs. Our pituitary glands it's the area where we secrete this FSH to stimulate more eggs to come out. But that's why there's high level in your lab work. Keep stimulating this FSH to make you ovulate on your eggs. And if there's no more eggs, guess what? It keeps secreting. That's why before our period, perimenopausal age, we get really cranky, moody, and our brain is really pituitary gland is really working hard to secrete these eggs. And guess what? All these fluctuation hormones, and the lower your estrogen, the more inflammation in our body. Our joints become stiffer and tighter. And that's why it's best to start really taking care of our health, seeing your gynecologist, and start doing some program to keep it strong and healthy, eating a lot of macros of protein to build muscle and to limit a lot of carbohydrates, sugary drinks, and caffeine. And if you are drinking a lot of these stimulants and creating these problems. That's why our estradiol, where do we get our estradiol? It's actually being secreted from your adrenal gland. So adrenal glands is located on top of the kidneys. So it's best to keep your cortisol level. So the adrenal glands also secretes our cortisol. And cortisol is actually not bad. It's actually unhealthy when we don't have cortisol, but it becomes bad when you're still secreting cortisol all the way in the afternoon. Our body starts waking up in the morning, and the cortisol is the hormone that helps you wake up and warm up our body in the morning. Automatic clock, and then it peaks around 10 a.m. That's why around 10 a.m. you feel the sharpest. And that's why I'm recommending for you to lower your stress, your lifestyle modification. And this is one of the best. Strengthening core exercises and making sure proper sleep hygiene. Sleep is great for our hormones. Sleep is great for our pelvic floor and for our spine, for inflammations. But if you need some more hormone supports, there's a lot of bioidentical hormones out there. See your doctor, check out your lab work. And once you check everything, then once you build strength, it's easier for our body to heal and build strength. Okay, my friends, let's begin our exercises now. I'm here at Lake Ray Roberts, and I'm here with my family paddleboarding, and I'm hoping you're having a great Sunday. So in this video, we'll be talking about pubic pain, which is pain in front of your pubis here, and our SI joint, which helps stabilize our pelvis, and hip instability and weakness. So you will need a foam roller to stabilize it. And that's why I'm here to talk about our hormone health and everything about pelvic floor, our spine. And if you need help, one-on-one help, my recommendation is to have a free one-on-one call with me, Comment Coach, COACH, if you want to book a free call and learn more about your back, your core back protocol, learn more about core back protocol, core back immersion therapy to help strengthen and improve the stability of your spine. If you're suffering for many years or recently, it's not too late to build strength. So in this video, we'll be focusing on our labrum, if you have hip joint instability, if you have labral pain, and as well as pubic pain. So if you notice, if you can't stand up for 10 minutes and you feel unstable on your hips, there's a lot of factors. First, endurance of your core. Number 2, your gluteal strength. Number 3, your hip stability. Number 4, there could be an injury on your pelvic floor, your tailbone, or your pubic bone, or your SI joint. So how do we fix it? Of course, I want you to see your local doctor, your physical therapist, do a proper assessment. But if you have everything checked and you know what's going on, you can, with the clearance from your doctor, you can start exercising. So I talk a lot about hormone health, proper nutrition, proper lifestyle modification. So if you're suffering from all of these, you have to also incorporate proper eating habits. So making sure you have a lot of good macros, protein, proper sleep, proper hygiene on taking care of yourself. Lower your stress irritants. So what are your stress irritants? Could be too much being on your phone. So if you're always on your phone and you're scrolling away, dopamine released by scrolling, our dopamine is naturally being secreted, right? If you have some of your pleasure lifestyle, it could be coffee, a little bit of alcohol, traveling, eating your favorite food, watching your favorite shows. But it's important also to make sure you put proper exercises. So this also releases dopamine. Sex, this is also releasing dopamine. So I want to make sure you properly combine everything in your lifestyle. Not too much of anything. A little bit coffee here and there won't hurt your pelvic floor, your bladder. But unfortunately, coffee is the only drink that makes your bladder lining inflamed. So I always recommend my patients to at least drink at least 12 ounces of irritants. What are those irritants? It's going to be inside my Revive Pelvic Floor Health Core Rehab. It's a lot of lists. Learn about what are your irritants that causing inflammation on your bladder lining. And when you're having bladder spasms, it also affects our hip joint, our back. Everything is connected. What we eat, what we drink, it all covers everything. So today we're going to need a foam roller. So we want to make sure you cover everything, lifestyle modification, checking to your gynecologist, making sure everything, your hormone panel is great. Okay, let's begin the program. We're going to start in lying on your back. We want to start stabilizing first. So this is a very soft foam roller. If you need a very soft foam roller, I have a limited supply of my foam roller. Comment foam, FOAM right now, so you can access my soft foam roller. It will be directly sent to your link. And the foam roller is very soft. and it's very hard to find a soft foam roller, and this is only 3 inches, so it's great for beginners. So we're gonna start building strength and stability by squeezing and isolating and improving the stability of your pelvis. So we're gonna lie on your back first, placing the foam roller between your knees. I want to make sure you take a deep breath through your nose. When you inhale through your nose, you want to expand your belly. When you do that, your diaphragm starts going down, and see my belly is rising. That pushes your pelvic floor to stretch down as well. As you exhale, I want you to squeeze your core in, like zipping up motion, blowing through your mouth, like blowing through a straw. The longer the straw, the more you engage your pelvic floor, slow and steady. I don't want you to blow like this. When you blow like that, you're not suctioning like a canister motion with your pelvic floor. So inhale through your nose, expand your abdominal muscles, and the diaphragm goes down and it stretches your pelvic floor. As you exhale, zip it up. As you zip it up, you want to slowly squeeze the soft foam roller. You can use softball, a roll towel, or pillows. And you're going to feel some shakiness. You can start 5 seconds for absolute beginner. And you might feel some ache, which is fine as long as it's not sharp pain. It's just a deep ache on your pubic bone or your SI joint. So we're gluing them together. So inhale, slowly release the foam roller. Exhale, squeeze gently. After doing that 10 times, now we can slowly glue them together. Place your hands on your side. So you want to make sure you know your SI joint dysfunction. If one of your pelvis is lower and one is higher, you can check out in my list of exercises. Example, if my pelvis is lower in my left, you can check it out. This is the pubic bone, and you can check if one side is lower. So to learn more about it, you can check out in the info card above here, learn more about SI joint dysfunction. So my best recommendation is to put the foam roller in front and then one at the back and lift it up in double tabletop. So what I'm doing, I'm pressing against, I'm placing one hand on the end of the foam roller. I'm pulling this hip in. My left side is my weaker side. That's my hip that's a little bit lower. My pelvis is lopsided to the left from childbearing age. When I was giving birth, I was bed rest for my firstborn son. And that's why I still continue with this. So I'm pressing with my right thigh going against the foam roller, and I'm lifting my left knee up. As I inhale, exhale, I'm feeling that instability. I might feel a little bit ache, and that's okay. And then down, hold it for 10 seconds. Again, inhale, exhale, press. So because this is a soft foam roller, it feels good on my thighs, it feels good on my knee, and I'm really feeling that deep ache on my left. I'm slowly lifting my left side. Again, inhale, exhale. So I'm incorporating with my breath, engaging my core. Inhale, exhale. And my recommendation is 5 seconds hold for absolute beginners. If this is too aggressive, lifting your leg up, my best recommendation is placing your foot down and just hold on your hand for absolute beginners. And then after 10 times on one side, then interlock your fingers and then go against. The right side is my higher side. I want this right side to go down, and I interlock my fingers behind my thigh and I'm pressing against it. And do that 10 seconds, hold as well 10 times on this side. And after I do that, I'm gluing them together. So it's important to stabilize your SI joint, your pubic bone pain, if you have groin pain and pubic pain. So as I place the foam roller here in between my thighs, placing my hands on both my hands on the side of my pelvis, you take a deep breath first through your nose, expand your belly, exhale, zip it up. As you zip it up, you slowly lift your hips up as I squeeze the foam roller and breathe out. Once I reach up, I take a deep breath again. You can see my belly rising. As exhale, zip it up. I'm squeezing my core in, but zipping it up motion. I don't want any downward pressure. I want to slowly roll down one vertebrae at a time and exhale. All at the same time, squeezing my glutes and then squeezing the foam roller. So inhale, expand. Exhale, squeeze and lift. And then once you reach up, you take a deep breath again, expand your belly. And then exhale, keep squeezing your knees and slowly roll down one vertebrae at a time. Inhale, expand. Exhale, squeeze. Inhale, I'm expanding. Exhale, squeeze and roll down one vertebrae at a time. After gluing them together, wait for at least 2 to 3 weeks before you do the kneeling exercises. So the kneeling exercises is a little bit more aggressive. There should be no pain while performing these exercises. So in kneeling, as long as you don't have knee pain, you can place pillows on your knees for support. And then I'm going to place the foam roller. So I want to strengthen my left side is my weaker side. I'm going to place the foam roller on my right. So why I'm doing that? Because the purpose of that, you're stabilizing on your left. But at the same time, you also stretch the opposite side. It's good to do both sides as well. As you inhale with tall kneeling like this, one leg out, you exhale down. Inhale, exhale up, zip it up. Breathe in. So make sure you have a foam roller here for a deeper stretch as you can glide down slowly. So I'm placing it on the inner side of my ankle. As I exhale up, zip it up. Inhale, I'm expanding my belly, stretching my pelvic floor. Breathe out, keeping my spine straight. I'm not rounding like this. And then slowly, when I'm about to go down, I'm pushing my buttocks out, down, and to my heel. And then core engage, keeping my spine straight all at the same time. Inhale, exhale, zip it up, and slowly go down. And breathe out again. Breathe in and breathe out, lift. Zip it up, and then expand as you inhale, and then exhale, zip it up again as you go down. Inhale, exhale, lift. Breathe in, breathe out, slowly go down. Inhale, expand your belly and lift. And then you can progress with gentle rotation, which means I'm slowly turning my body away from my right side. So I'm turning my body to the left. I'm feeling a deeper stretch on my groin. And then down. So that's a gentle progression. Inhale, exhale up and twist. Inhale, exhale down. Slow and steady. Feels a gentle stretch. Feels so good on my glutes and my groin, the mirror of your pelvic floor, your groin area. Now, after 10 times doing that, switch to the other side with your leg out. Inhale, exhale, slowly go down. Place it on the inner thigh of your thigh. So this is 3 inches. And there's also 6 inches diameter. And that's a little bit more challenging because it's higher, right? So if I have a 6 inches, so your leg will be higher all the way up. So 3 inches is a great starting point. So place it on the inner thigh of your inner side of your ankle. Inhale, expand your belly, exhale, roll, go all the way down and glide. So you want to make sure you glide easy and down. Slightly leaning forward, engaging your gluteal muscles on your right. And you might find one side easier than the other. Make sure there's no pain. Inhale again, exhale, zip it up. Inhale, exhale down. Breathe in, expand. Don't forget your breath. Exhale up, zip it up. Inhale, exhale down. 2 more. Inhale, exhale up. Inhale, exhale down. And now we're going to progress with a little bit twist away and gentle stretch. Inhale, exhale up, and then twist. Twisting my body gently will have a deeper stretch of my groin. Breathe in, breathe out down. Inhale, exhale up, and then twist. As we progress and put more pressure downward on your hip joints, pelvis, and also your pelvic floor. And after 2 more weeks, without any more pain, now we can stand up. So standing is the last progression. With the foam roller as a support, feet apart, toes slightly, your feet slightly diagonal to a 45-degree angle. As you breathe in, expand your belly. As you zip up, slowly lunge on one side. So I'm lunging on one side and exhale. I'm going to feel that stretch on my groin here without pain. As I said, you wait until 2 months since the lying on your back. This is the gentle step-by-step guide before you progress. And then inhale, exhale, lean now on the other side. So the foam roller gives you support. If you don't have a foam roller, you can use any table for stability or chair. Breathe in, breathe out. This is 36 inches length, so it's a great height for me. Inhale, exhale, I'm short. So it's enough stability and at the same time a little bit challenge. Inhale, exhale. Slow and steady. And then a gentle progression. If you have more stability and less pain, lean and twist. So as I twist, I'm going to feel a little bit stretch. At the same time, lean, lunge side slightly. You can also slowly lean forward further to engage your glutes and then twist. The gentle rotation helps. Breathe in, back center. Exhale, lean, side lunge, and then twist. You're gonna feel some deep ache. Inhale, exhale, lean, and then twist. And after doing that 10 times and there's still no pain with the twist, you can challenge now by standing on one leg. So that's why standing on one leg with SI joint dysfunction is a big no-no. But after 2 months of building strength, you have to challenge in a little bit of the stability. Standing on one leg is crucial. So it's important for sit to stand, for getting up and down the stairs, getting in and out of the car. So as you lean on one side, that's why it's nice to have a foam roller. Step and then kick. When you kick like this, you're challenging your right glutes. This helps strengthen as well at the opposite side. And then step down and then lunge first. As you breathe out, don't forget your breath. And then step closer together and then kick. So you feel one side more unstable than the other, and try to add an extra repetition or sets on the bad hip or SI joint or pubic pain. They're all interconnected. Breathe in, keeping your knee straight. On the opposite side, bend the opposite knee. I'm on the same side, and then you lean, slightly lean. Engage your glutes. Step and then kick. Breathe in, breathe out. See, your groin pain is slowly diminishing. You're getting more engaged on your core, and kick. Inhale. See, I'm leaning. And it's nice to have that foam roller. As you get better, maybe in 3 to 4 months, without the foam roller now you can challenge. Once you find that stability and control with breath, without any pain, then continue. So these are my gentle step-by-step guide if you have SI joint dysfunction, pubic pain, pelvic floor issues, leakage. It's important to keep everything strong and stable due to trauma, perimenopause, postpartum, or menopausal symptoms. So if you have any questions, leave a comment down below. Or if you need my hold your hand, I have a free one-on-one coaching call. Comment coach right now, and I'll send you the link if you're suffering from back pain and you want to fix it for good. If you're perimenopause, menopausal, or postpartum women, and you don't know where to begin, and you tried everything from physical therapy, acupuncture, massage therapy, and there's no improvement. So I'm having this one-on-one call. You can free booking right now. Book a free call right now to learn more about core back protocol for my back masterclass. And I'll be launching a new series for Bloom, an 8-week Revive Your Pelvic Floor Health Core Rehab. Click the link down below. Comment Bloom right now, BLOOM, so you can start blooming your pelvic floor, reviving your pelvic floor health so you're not suffering from leakage, pain during intimacy, close your diastasis recti if you have a gap due to postpartum, or even perimenopausal, menopausal women that have patients started having diastasis recti because they started having this difficulty with digestion, constipation, and there's a lot of issues why sometimes we get bloated as we decrease our estrogen. So that's why it's important to start building our strength. It's not too late. And one of my best recommendations is to really challenge your core, challenge your hip strength. Try not to sit more than 30 minutes. Try to slowly build up. But I don't want you to stand up for hours as well, because standing too long is also not healthy. So my best recommendation is to walk. Walking is the best exercise for our pelvic floor, but not too much as well. You have to slowly build without any symptoms. Example, I want you to start walking morning, after breakfast, lunch, and dinner, 10 minutes each time. You already started your 30-minute workout, right? For the day. If you break it down, morning, lunch, and dinner, after each meal, walk for 10 minutes. Slowly increase the time until you can do 15, 15, 15, until you can do 20, 20, 20. If there's a lot of pain, if you're having more leakage, then stop. Always remember, slowly build it up, especially with our pelvic floor health, a hammock-like structure that takes time to build strength. So if you have more time today and you're suffering from hip groin pain, check out this video about obturator internus, which is part of our pelvic floor muscles, and this video about piriformis syndrome, which is a pain that feels like a sciatica, but it's actually the piriformis pinching it because of tightness, and it radiates down your leg. Until my next video training, always remember, be safe, be well, and healthy you. Bye!